All right, I see we're at the top of the hour, so we can go ahead and get started. Has everybody seen the presentation? I believe.
Yes.
Okay, thank you, Lisa. I always feel like I share the wrong screen. So good morning, welcome to the Comagine Health weekly webinar series for long-term and post-acute care facilities to support the COVID-19 vaccine and booster rates. Thank you for spending your time with us today. I have a few housekeeping items to share before we get started. Just take a moment to locate the chat feature at the bottom of your screen. And please feel free to share your thoughts, comments, and questions with all participants. And then members of our team will be monitoring the chat and can bring your questions forward, or you can ask them at the end of the presentation today. Links to the resources will also be posted in chat throughout the presentation. So now that you've located the chat, we'd like to know you, our audience. If you're joining from a care facility, would you please put your name and your facility's name and your role in the chat? This presentation is also being recorded and will be available on our website after. And the slide deck and recording will also be available on our website. So before we begin our presentation, we wanted to launch a brief poll and get a feel for how you and your facility are currently handling vaccinating your residents. Here's just a quick poll. How are you currently handling vaccination? Are you having a partner come on site? Are you transporting to a site? Or are you providing vaccines for your residents? Thank you so much. And it looks like we have several people providing vaccines on site. That is how our poll ended up. So this will be a great presentation. And with that, I would like to introduce you, your presenter today, Lily Mazmanian.
Thank you, London. Hello, everyone. Thank you for joining today. My name is Lily Mazmanian, and I'm an improvement advisor at Comagine Health. And I'm delighted to be presenting on vaccine storage and handling for today's session. But before we go forward with the presentation, I would like to make a brief disclaimer. Next slide, please. So this presentation is in no way a comprehensive list of information for properly storing and handling your vaccine supply, but rather a high-level basic overview for those thinking about storing and administering vaccines at your facility. Vaccine storage and handling information is too broad to include in this session, so please refer to CDC's Vaccine Storage and Handling Toolkit that will be shared later, and the vaccine manufacturer's guides, product information, and package inserts for more detailed instruction, information, and protocols. You may also contact the manufacturer or CDC directly for guidance. All the information I'll be providing is directly from CDC's Vaccine Storage and Handling Toolkit and from the manufacturers themselves. I would also like to add that although some of the information I provide will refer to all vaccines, this particular session will focus on COVID-19 vaccine products, which may be different from those for other vaccines. So please look for instructions and protocols for those particular vaccines. And refer to the COVID-19 resources, which include modules that I'll be providing at the end of the session. There'll be a further tool to assist you in the procedures and protocols. So why are we talking about vaccine handling and storage? We're talking about a proper vaccine storage and handling because they are important factors in preventing and eradicating many common vaccine preventable diseases. Yet each year, storage and handling errors result in revaccination of many patients and cause significant financial loss due to wasted vaccines. Failure to store and handle vaccines properly can reduce vaccine potency, result in inadequate immune responses in patients, and poor protection against disease. And patients can lose confidence in vaccines and their providers if they require revaccination because the vaccines they received may have been compromised. Applying best practices and recommendations will help protect your patients, shield your vaccine supply, and avoid the costs of revaccinating patients and replacing expensive vaccines. Next slide. So part of effective vaccine storage and handling is making certain you have an effective vaccine cold chain. A cold chain is a temperature-controlled sequence of processes that includes all vaccine-related equipment and procedures. It begins with vaccine manufacturing and ends with vaccine administration. Vaccines must be stored properly from the time they are manufactured until they are administered, because potency is reduced every time a vaccine is exposed to an improper condition. This includes overexposure to heat, cold, or light at any step in the cold chain. And once lost, potency cannot be restored. So an effective cold chain in your facility relies on three things: well-trained staff, accurate inventory management, and reliable storage and temperature monitoring equipment. And please note that the appearance of the vaccine isn't a good indicator that vaccines have been stored in appropriate conditions. Next slide, please. So let's first focus on staff training. For those that want to store and administer vaccines, it's important to note that all staff members who receive vaccine deliveries, as well as those who handle or administer vaccines, should be trained in vaccine-related practices and standard operating procedures. First and foremost, all facilities must designate a primary vaccine coordinator and a backup coordinator who will be responsible for ensuring that all vaccines are stored and handled correctly. The primary and alternate vaccine coordinators should be experts on your facility storage and handling procedures. Please remember that vaccine storage and handling practices are only as effective as the staff that implements them. Staff that is well trained in general storage and handling principles and organization-specific storage and handling standard operating procedures is critical to ensuring vaccine supply, potency, and patient safety. Next slide, please. Storage and handling training shouldn't be done only once. There are different instances where training should be implemented. Training should be done during new employee orientation, annually for all staff that have their hands in vaccine storage and handling as a refresher, whenever your facility gets a new vaccine added to your inventory, and whenever vaccine storage and handling recommendations are updated. Next slide, please. The next step for your facility in maintaining the vaccine cold chain is proper vaccine inventory management. And that starts with appropriate vaccine ordering and stocking only enough vaccines to meet patient needs. Storing a large volume than your facility needs can increase the risk of wasting vaccines if they expire before they can be used, or they are compromised in some way. So for example, due to a mechanical failure of a storage unit. Most facilities should also reorder based on patient needs after checking stock counts. Vaccine orders usually arrive within 1 to 2 weeks, but there can be delays. So when possible, avoid placing last minute or rush orders to lessen the risk of running out of vaccines. Next slide, please. When your delivery arrives, it is essential that any staff that accepts the delivery immediately notifies the vaccine coordinator. This should be part of staff training because it's an important step. Vaccines are expensive and can be can easily be ineffective and therefore go to waste. So making sure they're immediately unpacked and stored, properly prepared, and eventually administered correctly is critical. Next slide, please. When unpacking deliveries, immediately examine shipments for signs of damage and go to guarantee receipt of the appropriate vaccine types and quantities. We would need to examine the shipping container and vaccines for signs of physical damage and check the contents against the packing list to be sure they match. Vaccines and diluents must be carefully unpacked, stored at recommended temperatures, and documented immediately after they arrive. Do not place an unopened or unpacked shipment box in a vaccine storage unit because the cool pack shipped with the vaccine may make the package of vaccine too cold if placed inside the storage unit. For frozen vaccines, the packing list will show the maximum time vaccines can be in transit based on shipment date. So immediately check both vaccines and diluents expiration dates to ensure you have not received any expired or soon to be expired products. Immediately check the instruction card and the cold chain monitor, which is a device used to monitor vaccine temperatures during transport, if one was included, for any indication of a temperature excursion during transit. Next slide, please. So now let's talk about stock record best practices. Stock records are used to determine the type and amount of vaccines your facility should stock to meet the needs of your patients. At least once a month and before placing any vaccine order, count all vaccine and diluents doses to make sure the number of doses in the storage unit matches the number of doses documented in stock record. Always check expiration dates while counting stock and remove any expired doses immediately. Use a stock record to account for every dose of vaccine. This record would help you keep track of your inventory and can be in either paper or electronic form. This record should be updated weekly and includes vaccine delivery information listed on this site. But please note that state and local programs that have an immunization information system with vaccine inventory accounting functions will require vaccine providers to use the IAS to track their inventory. Next slide, please. It is essential for each vaccine storage unit to have a temperature monitoring device to ensure that vaccines are stored within the correct temperature range. The CDC requires a specific type of temperature monitoring device called a digital data logger to monitor COVID-19 vaccines. A digital data logger provides the most accurate storage unit temperature information, including details on how long the unit has been operating outside the recommended temperature range, or also known as a temperature excursion. DDLs using a buffer temperature probe provide the most accurate way to measure actual vaccine temperatures. Always using DDLs or a digital data logger with a current and valid with a valid certificate of calibration testing. Note that not all DDLs can measure ultra cold temperature, however. Using a buffer temperature probe provides the most accurate measurement of vaccine temperatures. However, many manufacturers use pure propylene glycol or a glycol mixture with a warmer freezing point. But for accurate ultra cold temperature monitoring, it is essential to use an air probe or a probe designed specifically for ultra cold temperatures with the digital data logger. Next slide, please. It is important your facility has proper storage and monitoring equipment that is set up correctly, maintained, and repaired when needed. This equipment protects patients from unintentionally receiving a compromised vaccine at your facility and protects your facility against costs of revaccinating patients, replacing expensive vaccines, and losing patient confidence in your facility. There are several types of vaccine storage units available. Purpose-built units are specifically designed to store vaccines. However, household-grade units are also, acceptable options for vaccine refrigeration under the right conditions. But you need to be careful with what those are. As always, refer to the guides. Household grades do not mean the refrigerators we have in our own homes. For instance, household grade units can be acceptable alternatives to pharmaceutical grade vaccine storage units. As the name implies, these units are primarily designed and marketed for home use. However, the freezer compartment of this type of unit. It's not recommended to store vaccines, and there may be other areas of the refrigerated compartment that should be avoided as well. If your facility provides frozen vaccines, a separate freezer unit is necessary. And note that COVID-19 vaccine products may impact the type of vaccine storage unit and temperature monitoring devices used to maintain the cold chain, including the use of ultra cold storage. Temperature ranges for COVID-19 vaccines may also differ from those for other vaccines. Carefully review the COVID-19 vaccine storage and handling addendum for information about which storage units and monitoring devices are appropriate, including specifications for monitoring devices that can monitor ultra cold temperatures, how to best monitor temperatures, and how a specific vaccine product's cold chain requirements may affect other vaccines in a storage unit. Next slide, please. The next step is reliable vaccine storage and temperature monitoring equipment. Do not store any vaccine in a dormitory style or bar style combined refrigerator freezer unit under any circumstances. These units have a single exterior door and an evaporator plate or cooling coil, usually located in an ice maker freezer compartment. These units pose a significant risk of freezing vaccines, even when used for temporary storage. Also pay attention to storage unit doors. A door that is not sealed properly or left open unnecessarily not only affects the temperature in the unit, it also exposes vaccines to light, which can reduce potency of some vaccines. Consider using safeguards to ensure the doors of the unit remain closed. For example, self-closing door hinges, door alarms, or door locks. To fully ensure the safety of vaccines, equipment should include a recommended unit with enough space to accommodate your maximum inventory without crowding. Good air circulation around the outside of the storage unit is also important. The storage unit should be placed in a well-ventilated room, leaving space between the unit ceiling and any wall. Nothing should block the cover of the motor compartment. The unit should be firm and level with the bottom of the unit above the floor. Studies find most units work best when placed in an area with standard indoor room temperatures, usually between 68 degrees Fahrenheit and 77 degrees Fahrenheit. Next slide, please. Another important step in vaccine inventory management is vaccine stock rotation. Vaccine stock should be rotated and checked for expired doses regularly. Any expired vaccines and diluents should be removed immediately to avoid inadvertently administering them. Arrange stock for each vaccine type so that doses with the earliest expiration dates are placed in front of those with later expiration dates. Next slide, please. In reliable vaccine storage, it is also important to plan ahead in cases of emergency. Emergencies like equipment failures, power outages, severe weather conditions, or natural disasters usually happen without warning and may compromise vaccine storage conditions. So backup options and having an alternate storage facility is a must. No piece of vaccine storage equipment is fail-safe. At some point, equipment will fail for various reasons, such as a power outage, breakdown, or normal wear and tear. So you should establish a working agreement with at least one alternate storage facility, even if you have a generator as a backup equipment. Make sure you have 24-hour access to that facility. Hospitals, other long-term care facilities, state depots, the Red Cross, fire stations, packing plants, and commercial pharmacies are some of the facilities that may be able to assist you. Your facility may also choose to have a backup storage unit so that the vaccine may not have to be packed or moved to an alternate storage facility if the primary storage unit fails. Next slide, please. A best practice for inventory management is using tally sheets. Tally sheets can help keep stock records up to date. The CDC recommends placing tally sheets outside the storage unit door or another easily accessible location, and have staff use tick marks to keep account of every dose removed from the unit. The vaccine coordinator or other designated person should rotate vaccines and diluent stock at least once a week, as well as each time your facility receives a vaccine delivery. This will ensure that vaccine expiring sooner are used first. The CDC has a vaccine tally sheet available to use in their vaccine storage toolkit that will be shared later, but the one that is going to be shared in chat is another tally sheet from the CDC that can be used as well. Next slide, please. Determining when a vaccine or diluent expires is a critical step in maintaining proper storage and handling. Understanding vaccine expiration dates can help you save your practice time and money. When the expiration date has only a month and a year, the product may be used up to and including the last day of that month. If a day is included within the month and year, the product may only be used through the end of that day. Some vaccines have a beyond use date, which is calculated based on the date the vial is first entered and the storage information in the package insert. If the vaccine has no beyond use date, use the expiration date provided by the manufacturer. The beyond use date replaces the manufacturer's expiration date and should be noted on the label along with the initials of the person making the calculation. Next slide, please. If the expiration date is not printed on the vaccine vial or carton, go to the following sites to determine the expiration date. The only one that doesn't appear to have a vaccine expiration date, I guess it would be considered monitor, is the Pfizer vaccine. So if anyone knows this to be false for any reason, please share that info with other attendants in the chat. Otherwise, please contact Pfizer or CDC for guidance. Next slide, please. Vaccines should be disposed of properly. This slide shows general guidelines of how to dispose according to the type. So for expired or compromised vaccines, you would have to contact your immunization program. For open and broken vials, unfortunately, those can't be returned back to the manufacturer and should be discarded. Next slide, please. So let's talk about what the manufacturers and CDC recommend for storage for specific COVID-19 vaccines. We'll begin with Pfizer's gray cap vaccine that is for those 12 years and older. This Pfizer vaccine is not to be stored in a standard freezer. Freezers aren't cold enough to store the Pfizer vaccines. So they need to be stored in ultra cold freezers or refrigerators. As you can see in the slide, the Pfizer vaccine will arrive between -130 degrees Fahrenheit to -76 degrees Fahrenheit. Always check the manufacturer's guide for unpacking the vaccine or any other vaccine so it's handled appropriately. Next slide, please. Okay. The Pfizer COVID-19 gray cap vaccine is never to be stored in the thermal shipping container it came in. Again, refer to the specific card that comes with the shipment to how to store the vaccines and follow what is written on the card. The vaccine must be stored between 130 degrees Fahrenheit to -76 degrees Fahrenheit to maintain its efficacy, and it should also be stored upright. Next slide, please. It's extremely important to protect the vaccine from light and to store it only until its expiration date. The vaccine expires on the last day of the 9th month. Use the month printed on the vial as month 1. Expired vaccines should never be administered. The CDC has a COVID-19 vaccine expiration tracking tool that can help you. but sometimes manufacturers may change the expiration dates. So contact the manufacturer to determine if the expiration date has been extended before discarding the vaccine. Use beyond use date labels to check how long the vaccine has been in the refrigerator or freezer. If you thaw the vaccine, do not refreeze the thawed vaccine. Next slide, please. Regardless of using an ultra cold freezer or refrigerator, storage unit temperatures must be monitored regularly, checked and recorded at the beginning of the workday to determine if any temperature excursions have occurred since the last temperature check. For accurate temperature monitoring, use a digital data logger with a detachable probe that best reflects vaccine temperatures. For ultra cold temperatures, use a probe designed specifically to measure ultra cold temperatures. For refrigerator storage, use a probe buffered with glycol, glass beads, sand, or Teflon. Check and record the temperature daily using CDC's temperature log. It is preferred that you check the minimum and maximum temperatures with a digital data log at the start of each workday. If the DDL does not display the minimum and maximum temperatures, then you can check and record the current temperature at the start and end of each workday. It is also recommended that you review the DDL temperature data daily. Next slide, please. The Moderna COVID-19 vaccines are to be stored in a freezer or refrigerator and will arrive between -58 degrees Fahrenheit and 5 degrees Fahrenheit. It bears repeating that just like the Pfizer vaccine or any other vaccine, you are to unpack the shipment per the manufacturer's directions. Next slide, please. Unpunctured Moderna COVID-19 vials are to be stored in the freezer between -58 degrees Fahrenheit and 5 degrees Fahrenheit. You are not to ever store them with dry ice or below -58 degrees Fahrenheit. Next slide, please. You can store the Moderna COVID-19 unpunctured vaccine vials in the refrigerator between 36 degrees Fahrenheit and 46 degrees Fahrenheit for up to 30 days only. Again, thawed vaccines cannot be refrozen, and you can use the beyond date labels to track how long the vaccines have been in the refrigerator. You can do this by removing the box from the frozen storage, completing the information on the storage label and attaching it to the box holding the vaccine vials. And once labeled, you can store the vaccine in the refrigerator. Next slide, please. Moderna COVID-19 punctured vaccine vials may be stored between 36 degrees Fahrenheit and 77 degrees Fahrenheit for up to 12 hours. After a vial has been punctured 20 times, it should be discarded even if the 12 hours time limit hasn't been reached. Next slide, please. The Janssen COVID-19 vaccine is initially stored frozen by the manufacturer, then shipped at 36 degrees Fahrenheit to 46 degrees Fahrenheit. If the vaccine is still frozen upon receipt, you can thaw it at 36 degrees Fahrenheit to 46 degrees Fahrenheit. If the vaccine is needed immediately, it may be thawed at room temperature at a maximum 77 degrees Fahrenheit. Again, do not refreeze it once it has been thawed. The unpunctured multi-dose vials of the vaccine should be stored at 36 to 46 degrees Fahrenheit and protected from any light. Unpunctured vials of the vaccine may be stored between 47 degrees to 77 degrees Fahrenheit for up to 12 hours only. At room temperature, a carton of 10 vials will take about 4 hours to thaw, and an individual vial would take 1 hour to thaw. Next slide, please. Before preparing the Janssen vials for administration, please note that the vaccine should be colorless to slightly yellow, clear to very opalescent. So before administering it, visually inspect the Janssen COVID-19 vaccine vials for particulate matter and discoloration prior to administration. If either of these conditions exists, do not administer the vaccine. Before withdrawing each dose of vaccine, carefully mix the contents of the multi-dose vial by swirling gently in an upright position for 10 seconds. Do not shake. Each dose is 0.5 milliliters, and each vial contains 5 doses. Do not pool excess vaccine from multiple vials. The Janssen COVID-19 vaccine does not contain a preservative. Record date and time of first use of the vaccine via label. After the first dose has been withdrawn, hold the vial between 36 to 46 degrees Fahrenheit for up to 6 hours or at room temperature, and only at maximum 77 degrees Fahrenheit for up to 2 hours. Discard if the vaccine is not used within these times. Next slide, please. So we just noted how important it is to have vaccines at a particular temperature for each vaccine noted by each of the manufacturers and the CDC. But what happens in the case of a temperature excursion? The CDC recommends the following steps in the event of a temperature excursion. Any staff who hears an alarm or notices a temperature excursion on the DDL should notify the primary or alternate vaccine coordinator immediately or report the problem to their supervisor. You can notify staff by labeling exposed vaccines do not use and place them in a separate container apart from other vaccines. The vaccine coordinators, supervisor, or if necessary, the person reporting the problem should begin to document the event with the following information: the date and time of the temperature excursion, storage temperature, as well as the room temperature if available, name of the person completing the report and the description of the events, general description of what happened, length of time the vaccine has been affected, if you're using a DDL, inventory of affected vaccines, list of items in the unit, including the water bottles or other vaccines, any problems with the storage unit and or affected vaccines before the events, and any other relevant information. Next slide, please. We mentioned this briefly before, but storage unit temperatures must be monitored regularly and checked and recorded at the beginning of each workday to determine if any excursions have occurred since the last temperature check. For accurate temperature monitoring, use the DDL logger with a detachable probe that best reflects vaccine temperatures. Check and record the temperature daily using a temperature log. Next slide, please. Before administering the vaccines have to be properly thawed. The instructions for how to thaw will be in the insert of each vaccine when they are delivered. Remember that each has a different temperatures and times they need to be thawed in. They're not the same and each has different instructions, so please note it carefully. Also, the time needed to thaw the vaccine varies. One vial will take less than thawing a number of vials together, so you will need to coordinate the time appropriately for when you will need them. And I said this multiple times, but once the vaccine has been thawed, you are not to refreeze them again. If you need help with the storage temperatures, the CDC has the beyond use date labels that you can use on the vials to help you track refrigerated and frozen temperature storage times. Next slide, please. So let's go through each manufacturer's thaw temperatures, and we'll begin with Pfizer. According to the CDC, unpunctured vials may be stored in the refrigerator for up to 10 weeks. Unpunctured vials may be stored between 46 and 76 degrees Fahrenheit for a total of 12 hours prior to the first puncture. Unpunctured vials may be held at room temperature for up to 12 hours, including thaw time for up to 77 degrees maximum, which includes the thaw time. Next slide, please. According to the CDC, unpunctured vials may be stored in the refrigerator between 36 degrees Fahrenheit to 46 degrees Fahrenheit and up to 30 days in the refrigerator for the Moderna vaccine at room temperature. And at room temperature, unpunctured vials should be kept between 46 degrees Fahrenheit and 77 degrees Fahrenheit. Next slide, please. Thank you. The Johnson COVID-19 vaccine is shipped at 36 degrees Fahrenheit to 46 degrees Fahrenheit. If the vaccine is frozen upon receipt, you can thaw it at 36 to 46 degrees Fahrenheit. If needed immediately, thaw at room temperature, again at maximum 77 degrees Fahrenheit. At room temperature, a carton of 10 vials of the Johnson vaccine will take 2 hours to thaw. At room temperature, an individual vial would take 1 hour to thaw. Next slide. Vaccine preparation is the final step in the cold chain before administration. Handling vaccines with care is equally as important as storing them properly. So please prepare vaccines in a designated area away from any space with contaminated items where contaminated items may have been placed, and only prepare them when you are ready to administer them. Again, check for the expiration date and to confirm you have the correct vaccine as well, and only administer the vaccines you've prepared. This is a quality control and patient safety issue and a best practice standard of medication administration. Next slide, please. And finally, according to the CDC and federal guidelines, and hopefully this will also sum up some of what we have gone over today, all COVID-19 vaccination providers participating in the United States COVID-19 vaccination program are required to sign a COVID-19 vaccination program provider agreement to receive delivery of any COVID-19 vaccine from CDC's distributor or a COVID-19 vaccine manufacturer. The agreement must be completed by all public and private providers, provider organizations, and government-affiliated federal, state, territorial, and local providers. As part of the agreement, providers are required to store and handle COVID-19 vaccines under proper conditions, including maintaining the cold chain conditions and chain of custody at all times, in accordance with the emergency use authorization or vaccine package insert manufacturer guidance and CDC guidance in the toolkit. And we need to also monitor, they also need to monitor storage unit temperature at all times using equipment and practices that comply with guidance in the toolkit. So comply with immunization program guidance for handling temperature excursions. They have to monitor and comply with COVID-19 vaccine expiration dates, preserve all records related to COVID-19 vaccine management for a minimum of 3 years, and comply with federal instructions and timelines for disposing of COVID-19 vaccine and diluents, including unused doses. Hopefully this information gave those of you who want to start storage in your facility the basic understanding of some of the steps and protocols of storage and handling and what you need to do before administering. For those that already do this, I'm hoping that there was some additional information you didn't already know that you can immediately use at your facility. And before we go on to resources, are there any questions? Okay.
Not seeing any in the chat, Lily. And maybe we can go through the resources.
Right.
Great.
Right. Yes, definitely. So so please sign up for, if you haven't already, to your state's immunization information system. It's useful for looking up staff and patient immunizations, and some IAS may help with your vaccine inventory. Next slide, please. This slide is just additional resources for the Pfizer COVID-19 vaccine, including the storage and handling requirements summary of the vaccine. Next slide, please. And the following is additional information for the Moderna vaccine. And the Janssen vaccine as well. Next slide, please. There are specific vaccine training modules provided by the CDC that I thought I would share. I believe they offer credits as well, so it'd be worth looking into for additional information beyond the session and what's included in the toolkit that I'll be sharing. Next slide, please. The CDC also has a tool to document any unacceptable vaccine storage events, such as exposure to temperatures outside of the recommended storage ranges. There's also a pre-vaccination guidance for healthcare professionals and an immunization schedule for the COVID-19 vaccine. And the next resource is the actual vaccine storage and handling toolkit, which I used all the information for, that is provided and created by the CDC. And the vaccine storage and handling resource that it included has other additional information that is extremely useful. And next slide, please. And the open office hour for the session is this Friday at 11 a.m. Pacific and noon Mountain Time. I believe we have 3 more sessions coming up, the last one being on May 24th. So if you're not already registered for the series, you can register for the final sessions through the link provided in chats. And finally, the people listed on your screen are your state's contacts. Please connect with them if you have any questions. Thank you again for joining us, and we hope you have a wonderful rest of your day.
I did launch a poll really quickly. Thank you, Lily, for all of the wonderful information you just provided us with. If you found today's presentation to be useful, please take our standard evaluation. Even if you didn't, we would love to hear your feedback. We know it was a long presentation today. Thank you so much for spending your time with us.